Are you suffering from diabetes? If yes, I'll tell you the science and the relation between diabetes and oral health. It becomes very important to maintain your teeth if you're suffering from diabetes. To understand diabetes, let's follow the simple measures, and we need to understand what actually is happening around the world. We Asians comprises of 80% of the world population who's suffering from a lifestyle disorder. Let it be a high blood pressure, hypertension and diabetes. All these diseases lead to a poor oral health. Or we people are suffering from bad teeth or maybe a lot of cavities, further predisposing to malfunctioning and the poor odor or the malodor. Everything depends the way a clinician sees you. Suppose if somebody is diabetic and he or she is coming to my clinic, I don't have to dig more into a medical history to find out whether they are diabetic or not. So example, it depends. The patient is giving me all the clues. I need to understand what actually is wrong. So maybe the patient who are diabetic, this area would be a little swollen. The reason, we have got 3 pair of glands. So these people, they're striving hard to accumulate the saliva because these people must be on an anti-diabetic pill like metformin and all these drug medication. So these people would have the salivary flow very less. So comparatively, the medication they are on, they're knocking off the salivary glands, which is actually driving the salivary gland to work harder. So they've got a dry mouth. And in case if they've got a dry mouth, these would be little swollen. So the moment I look at a patient, I know he or she might be a diabetic. First point, I get to see the Asian, middle-aged, lifestyle disorder, little obese, and this part is swollen. I need not find anything else unless I have to ask them formally, because more or less I've made up my mind. I know that they would tell me about any of a diabetic history. Having said this, how do I evaluate? The moment I tell them, most of the patients, they might not know that they've got a diabetes or not. And in my clinical routine practice, I can't tell them go for a blood glucose or a random control, blood sugar levels and everything. It's a simple basic test. I'll take a small beaker, ask them to wait in a waiting room. I don't need to give them any magazine or anything, they should be sitting there idle for about 15 minutes. I ask them to collect the saliva, and after 15 minutes, they should spit the saliva in a small beaker. What a gold standard says, saliva should be of 1.5 milliliter in a normal human being who is swallowing and salivating at the same rate. So 1.5 milliliter of saliva in a 15 minutes is an ideal salivary flow rate. We call it cialometry. So it's just a normal routine. And purposely, I ask my patient, please have a cup of coffee or a tea. I offer them biscuits. The moment, and plus I keep a little glass of water in front of me. So the moment they tend to take a biscuit, their hand would find a water. So if it means they need more water to swallow that. It's a clear indication. So I'm giving you a simple measure. You can try this back at home and you'll find that your relatives, your friends, whether they are diabetic or not. Very likely these small petty home measures, they hold good. And now if I know this is what is happening, my job is to eradicate this and to educate them how to take those simple measures so that they don't fall out, so that they don't need to visit a dentist again and again. We are running dental practices. For us, it's very good. We get a lot of patients and business. But the idea is to educate people, tell them, focus more on prevention so you don't get to see us. And we get a lot of referrals in other cases. So what's going to happen? So if I'm diabetic, I've got a dry mouth and saliva is very less. So very basic things. Tongue, the tip of tongue, that would be rough because the papillas or the taste buds, they would need more water in the dry. My palate, it might be having some sort of fungal infection. Back of my tongue will have a fungal infection. I'll struggle while eating. So most of the food debris, they would get accumulated around the margins of the teeth, hence leading to more cavities. We call it cervical caries because they are around the cervical margin of the teeth. So these are the adverse situation where someone can land if you're suffering from a diabetic situation. So if we talk about the measures which you should be taking in case if you're diabetic to maintain your oral and dental health, please brush twice daily. That goes without saying. Kindly carry a small bottle and you can have small sips of water. Drink small sips of water to keep your mouth moist. You can carry a small bottle again for a milk, as milk is an emollient. It has got basically, it's an oil base, so that would keep your mouth moist. Third, take your medication regularly and properly. All the anti-diabetic medication. Consult your dentist every month, and you should see your general physician or the person who's taking care of your diabetic medicine on a regular basis in case if your dosage needs to be monitored or regulated. Make sure that you visit your dentist regularly and ask him or her to sort out your filling and dental cavities. There's also one area, it's a missing link between a dentist and a physician. If you go to a physician and you're suffering from a diabetes, like severe diabetes, and you've got a severe dry mouth, often physician missed out on a situation or a medication which is called oral salivary substitute. And dentists, they don't know it either. So I would still recommend you to go for an artificial saliva. That's an oral salivary substitute. It's kind of a gel. It's 1 to 2 drops which you can keep in your mouth for about 2 to 3 times in a day. And having done this, your mouth would remain moist throughout the day. You need to consult a specialist regarding this, and they'll be able to tell you what quantity and what dosage. And that's the superb solution in severe dry mouth cases. Please do not neglect your teeth and oral health if you are diabetic.